Imagine waking up tomorrow morning, stepping on the scale, and seeing your blood sugar reading 20 points lower than yesterday. Sounds like a miracle, right? Well, I've been practicing family medicine for 28 years, and I've seen it happen more times than I can count. Let me tell you about Margaret, a 72-year-old retired school teacher who came to my office 6 months ago. She was frustrated, exhausted, and scared. Her fasting blood sugar had been creeping up into the pre-diabetic range for 2 years, and her doctor had warned her about type 2 diabetes. She tried every diet, every supplement, every piece of advice from well-meaning friends. Nothing stuck. Then she asked me a simple question. Doc, is there anything I can drink before bed that actually helps? That question changed everything. And today, I'm going to share 4 bedtime drinks that flush excess sugar while you sleep. Number 2 works in one night. But before I get to that, let me first explain why your blood sugar spikes at night in the first place. Because understanding the problem is the first step to solving it. Your body has a built-in mechanism called the dawn phenomena. Around 3 or 4 in the morning, your liver releases a surge of glucose into your bloodstream to give you energy to wake up. That's normal, but as we age, our cells become less sensitive to insulin, and that glucose surge doesn't get cleared properly. So you wake up with higher numbers than you went to bed with. And if you've eaten a meal high in refined carbs before bed, that just adds more fuel to the fire. The result is a slow, steady climb in blood sugar that increases your risk of heart disease, kidney damage, nerve pain, and even dementia. I've seen patients lose their independence because they couldn't manage their blood sugar. It's not just about numbers on a lab report. It's about waking up feeling clear, energetic, and in control of your life. Margaret felt that fear deeply. She told me she couldn't remember the last time she felt well rested. She'd lie in bed worrying about what the morning would bring. That's the emotional cost we don't talk about enough. Now, over the years, I've learned that the most effective interventions are often the simplest. And what you drink before bed can have a surprisingly powerful impact on your overnight glucose regulation. Let me explain the mechanism. When you drink certain compounds, they work through different pathways. Some slow down the absorption of carbohydrates. Others improve insulin sensitivity. Some stimulate the liver to stop releasing so much glucose. And a few actually help the kidneys flush out excess sugar through urine. I want to focus on number 2 first, because it's the one that can make a noticeable difference in a single night. It's a combination of 2 ingredients you probably already have in your kitchen: apple cider vinegar and a pinch of cinnamon. I know, it sounds too simple, but there's real science behind it. Apple cider vinegar contains acetic acid, which has been shown in multiple studies to improve insulin sensitivity and reduce post-meal blood sugar spikes. A 2007 study published in Diabetes Care found that taking 2 tablespoons of vinegar before a high-carb meal lowered blood sugar by as much as 20%. And cinnamon? It contains a compound called MHCP that mimics insulin and helps cells absorb glucose more efficiently. When you combine them in a warm glass of water before bed, you create a powerful overnight flushing mechanism. Margaret tried it for the first time on a Thursday night. She measured her blood sugar before bed at 142. The next morning, it was 111. She called my office the next day almost in tears. "It's been years since I saw a number like that," she said. Now, apple cider vinegar and cinnamon isn't a magic bullet, but it's a tool that works remarkably well for many people. And it's just one of 4 drinks I recommend. The other 3 include a warm cup of chamomile tea with a squeeze of lemon. Chamomile has been shown to reduce inflammation and improve glucose metabolism. Then there's a green tea with a dash of cayenne pepper. The catechins in green tea enhance insulin sensitivity, and cayenne boosts circulation and metabolism. And finally, a simple mixture of tart cherry juice and sparkling water. Tart cherries are rich in anthocyanins that help regulate blood sugar and improve sleep quality. But here's the thing. These drinks aren't just about the ingredients. They're about the habit. When you consistently drink something calming and supportive before bed, you create a ritual that signals your body it's time to rest and repair. And that's where the app I use with my patients comes in. I tell everyone to download the app from the link in the pinned comment. It's a simple way to track your blood sugar, log your bedtime drinks, and see how your numbers change over time. No cost, no catch, just a useful tool. Now, let me show you what the research says. A 2010 study from the American Journal of Clinical Nutrition found that consuming a small amount of vinegar before meals reduced blood sugar and insulin responses by up to 34%. And a 2012 meta-analysis of 8 trials concluded that cinnamon supplementation significantly lowered fasting blood glucose and insulin levels. These are not small effects, they're clinically meaningful. And for someone like Margaret, who was on the edge of needing medication, these drinks gave her a way to take control without prescription drugs. I've had dozens of patients with similar results. John, a 65-year-old retired mechanic, had been struggling with nighttime hypoglycemia. His blood sugar would drop dangerously low while he slept. After switching to a cup of chamomile tea with a pinch of cinnamon before bed, his overnight readings stabilized. His wife told me it was the first time in years he didn't wake up covered in sweat, confused and shaking. That's the power of simple interventions. Now, I want to address the most common objection I get. People say, "Doc, I don't have diabetes. Do I need these drinks?" Here's the reality. Blood sugar dysregulation doesn't start when you get a diagnosis. It starts years earlier, often in your 40s or 50s. The American Diabetes Association estimates that 34% of adults over 65 have prediabetes. That's 1 in 3, and most don't know it. So whether you have a diagnosis or not, supporting your body's natural glucose regulation is one of the most important things you can do to prevent chronic disease and maintain your independence. Let me expand on that. When you consistently keep your blood sugar stable, you reduce inflammation throughout your body. That means less joint pain, better brain function, lower risk of heart disease, and slower aging. I've seen patients who started these drinks and within a month reported clearer thinking, fewer food cravings, and more energy during the day. The benefits go far beyond the numbers on your glucometer. Now, let me give you 3 practical tips to implement these drinks starting tonight. First, always use raw, unfiltered apple cider vinegar with the mother. It contains beneficial bacteria and enzymes that enhance the effect. Mix 2 tablespoons in 8 ounces of warm water, then add a quarter teaspoon of cinnamon. Drink it 30 to 60 minutes before bed. Second, if you take medication for blood pressure or diabetes, check with your doctor before starting, because these drinks can lower your numbers enough to require adjustment. Third, keep a small notebook or use the app I mentioned to track your bedtime routine and morning readings. You'll be amazed at the patterns you discover. And here's a bonus tip. Don't eat anything within 2 hours of drinking your bedtime beverage. Your body needs to be in a fasted state to maximize the glucose flushing effect. That means no snacks, no desserts, no late night nibbling. Your liver does its best work when it's not busy digesting food. Now let me close with Margaret. 6 months later, her fasting blood sugar is consistently under 100. She's lost 12 pounds without dieting. She sleeps through the night. And she told me last week that she feels like she got her life back. That's why I do what I do. That's why I share this information. And that's why I hope you'll try these drinks for yourself. If you found this valuable, subscribe to the channel. I share new research and practical protocols every week to help you stay healthy, independent, and sharp. And don't forget to check the pinned comment for that app link and a few more resources I put together just for you. Here's to better mornings and healthier nights.